Look at what happens with glaucoma. Inside our eye, due to the vascular plexus, a process begins secretion of intraocular fluid. And this intraocular fluid, well, if you look at my balloon here, you understand that if I let the air out of it, it would just deflate and become just a piece of limp fabric. But in order for the balloon to stay a balloon, we fill it with air. The human eye, a marvel of biological engineering, is a complex and delicate organ that plays a crucial role in our ability to perceive and interact with the world around us. Its intricate structure is composed of multiple layers and specialized components, each contributing to the overall function of vision. At the front of the eye lies the cornea, a transparent dome-shaped surface that helps to focus incoming light. Behind the cornea is the iris, the colored part of the eye, which controls the size of the pupil and thus regulates the amount of light entering the eye. Just behind the iris is the lens, which further focuses light onto the retina at the back of the eye, where visual information is converted into electrical signals and sent to the brain via the optic nerve. For the eye to maintain its characteristic round shape and to function properly, it must be kept at a precise internal pressure. This is achieved through the continuous production and drainage of a clear, watery fluid known as aqueous humor or intraocular fluid. The production of this fluid is a highly regulated process that takes place in the ciliary body, a ring-shaped structure located just behind the iris. Within the ciliary body, a specialized network of blood vessels and tissues called the vascular plexus filters blood plasma to create the aqueous humor. This fluid then flows from the posterior chamber located behind the iris through the pupil and into the anterior chamber, the space between the cornea and the iris. From there, it drains out of the eye through a complex system of channels known as the trabecular meshwork and Schlemm's canal, eventually rejoining the bloodstream. The balance between the production and drainage of aqueous humor is essential for maintaining intraocular pressure within a healthy range. If this balance is disrupted, such as when the drainage channels become blocked or the production of fluid increases, the pressure inside the eye can rise to dangerous levels. This condition is known as glaucoma, a group of eye diseases that can cause progressive damage to the optic nerve. The optic nerve is responsible for transmitting visual information from the retina to the brain, and damage to this nerve can result in irreversible vision loss. Glaucoma has been recognized as a significant cause of blindness for centuries. Historical records from ancient Greece and Rome describe symptoms consistent with the disease, although the underlying mechanisms were not understood until much later. It was not until the 19th century that scientists began to unravel the relationship between intraocular pressure and optic nerve damage. Today, glaucoma is known as the silent thief of sight because it often develops slowly and without noticeable symptoms in its early stages. By the time vision loss becomes apparent, significant and irreversible damage may have already occurred. The experience of vision loss in glaucoma is unique. Unlike other eye conditions that may cause blurriness or cloudiness, glaucoma typically affects peripheral vision first. Individuals may not notice any changes until their field of vision has narrowed considerably, creating a tunnel-like effect. This can have a profound impact on daily life, making it difficult to navigate crowded spaces, drive, or recognize faces. As the disease progresses, central vision may also be affected, and if left untreated, glaucoma can lead to complete blindness. Several risk factors increase the likelihood of developing glaucoma. Age is a significant factor, with the risk rising sharply after the age of 40. A family history of glaucoma, certain medical conditions such as diabetes and high blood pressure, and prolonged use of corticosteroid medications can also increase risk. People of African, Asian, and Hispanic descent are at higher risk for certain types of glaucoma. Regular eye examinations are essential for early detection, as the disease can often be managed effectively if caught in its early stages. Diagnosis of glaucoma involves a comprehensive eye exam, including measurement of intraocular pressure, examination of the optic nerve, and assessment of the visual field. Advanced imaging techniques such as optical coherence tomography, OCT, can provide detailed images of the optic nerve and help detect early signs of damage.
Treatment options for glaucoma are aimed at lowering intraocular pressure to prevent further damage to the optic nerve. These may include prescription eye drops, oral medications, laser therapy, or surgical procedures to improve fluid drainage from the eye.
Living with glaucoma can be challenging, but with proper management and regular follow-up care, many people are able to maintain their vision and quality of life. Education and awareness are key to preventing vision loss from glaucoma. Public health campaigns and community outreach programs play an important role in encouraging people to have regular eye exams, especially those at higher risk. In summary, the round shape and proper function of the eye depend on the continuous production and drainage of intraocular fluid, a process orchestrated by the vascular plexus within the ciliary body. Disruptions in this process can lead to increased intraocular pressure and the development of glaucoma, a serious eye disease that gradually impairs vision. Understanding these mechanisms, recognizing the risk factors, and seeking regular eye care are crucial steps in preserving sight and preventing irreversible damage caused by glaucoma. By staying informed and proactive, individuals can protect their vision and maintain their independence and quality of life for years to come. This is normal vision. And here you see peripheral vision is impaired and only the center is visible. Here in the first picture you can see that only the very edges are missing. Here only the central vision remains, and in advanced glaucoma it can even affect binocular vision. So when vision is like this, try looking through tubes like this. Sometimes this is how people with glaucoma see when they can only see the areas where the macula is, that central part. Whereas with macular degeneration, the central part is lost. In glaucoma, the central part retains the ability to see for the longest time. How is glaucoma detected? Well, glaucoma is detected when a person's intraocular pressure is examined. Previously, we measured intraocular pressure by placing a small weight on the eye, and by the shape of the spot that remained, we would determine what the person's intraocular pressure was. But nowadays, this is done with eye tonometry special devices that remotely measure intraocular pressure. So we no longer torment people with those little weights. As for treatment, well, the treatment of glaucoma is related to this. Look, how can we improve the outflow of fluid from the eye if it's impaired because of this angle canal? Well, it's possible, but to do that, you need to affect the eye with certain medications: cholinomimetics, cholinoblockers, adrenomimetics, and adrenoblockers. In other words, specific types of drugs that act on the eye's adrenoceptors and cholinereceptors, thereby altering the autonomic state of the eye. Was that too complicated? Let me try to explain it more simply. In our eye, the shape of the eye, the condition of the pupil, the iris, and the state of the main musculara, well structures of the eye, are determined and regulated by the autonomic nervous system, the autonomic nerves, and we can reproduce autonomic impulses by introducing substances into our body that affect these autonomic receptors, either acetylcholine or adrenaline receptors. Such substances are called cholinergic if they are stimulatory mimetics, or cholinergic blockers if they are inhibitory blockers. And adrenergic if they are stimulatory mimetics, or adrenergic blockers if they are inhibitory blockers. These various cholinomimetics, cholinolytics, and adrenomimetics are the very eye drops that sometimes allow us to influence the structures of the eye by opening channels for the outflow of intraocular fluid. Therefore, by selecting the appropriate drops, we can achieve better drainage of the fluid, resulting in a decrease in intraocular pressure. Yes, for people with glaucoma who are not yet in the advanced stages, it is indeed possible to normalize intraocular pressure, and in that case, further destruction of the eye will not occur. Sometimes it is even possible to perform reconstructive surgeries, but this is already extremely complex and delicate microsurgery. And restoring the flow of ocular fluid there at the micron or even submicron level is extremely difficult to achieve surgically, even with microsurgery or laser surgery. And it is very difficult to ensure that during the healing process after surgery, proper healing occurs and normal intraocular fluid movement is restored. So what can be suggested? Guys, for anyone who has problems with glaucoma or elevated intraocular pressure, it is essential to sleep all night wearing a turmenium eye mask. In this way, the magnetic field of the turmenium mask improves the rheology, that is, the flow properties of the intraocular fluid, enhancing its drainage. It's simply sleeping with a turmenium eye mask. Next, in previous videos, I talked about and demonstrated the turmenium projector. The projector is made from turmenium ceramic material. We use it to warm up the eyes. With glaucoma, whether open angle or closed angle, you should not warm up your eyes. You shouldn't. What should you do? Watch closely. You heat up the projector to any temperature, even 70 degrees, which is allowed on the projector's remote control. Yes, even 70 degrees. You heard right, even 70 degrees. And then you do the following. You take the projector with one ball, if it's a 5-ball or 2-ball projector, and you massage the brow area with quick movements, not to hold and warm it up, but to massage the brow area, the temple area, which is here, and the infraorbital area, which is under the eye, that is above, to the side, and below the eye. Also 15 minutes for one eye and 15 minutes for the other if there is increased intraocular pressure in either eye. And with this kind of massage, by massaging, you improve the functionality of the tissues around the eye, eliminate the inflammatory process there, and help reduce the swelling of the trabecular meshwork and Schlemm's canals through which intraocular fluid drains. That is, you don't need to warm the eyes there. In fact, you must not warm the eyes if you have glaucoma. Normal intraocular pressure for a person is 16 to 20. So 20 is considered normal pressure. If your intraocular pressure is above 20, do not warm your eyes. What you need to do for your eyes is to use a turmenium eye patch near the eye and massage around the eye on top, on the sides, and underneath with a turmenium projector. And just to let you know, as practice has shown, this kind of massage around the eye led to a decrease in intraocular pressure in people. They go to the clinic, have their pressure checked, and it's already 18 or 19 lower, which is better. There are several factors to consider. Even if you have glaucoma and at the time you use your eye drops, your pressure is 20 or below 20 or less than, you do not currently have elevated intraocular pressure. In that case, with normal eye pressure, you can warm your eyes with the projector. But if at the moment your pressure is 21, 22 or higher, then in that case you should not warm your eyes. Instead, you need to massage around the eye. That's the whole difference. Glaucoma or not. Sometimes people come up to me and say, I have glaucoma. Can I warm my eyes? I ask, what is your eye pressure? The eye pressure is 18. Then you don't have glaucoma. No, I do. Droplets are dripping. As long as you're using drops and your eye pressure is normal, you can warm your eyes. But when you already have high pressure, that's when you can't. Sometimes people ask me, what if I don't know my pressure? What then? Then we go back to the previous slide. You go to the clinic and have your pressure measured. And you measure your pressure so you know it, so you don't, God forbid, cause yourself harm. A simple eye patch won't do any harm. But warming the eyes with glaucoma can only increase blood flow to the eye, the production of intraocular fluid, and raise intraocular pressure. That's why you shouldn't warm your eyes in such cases. There's your solution to the problem. A possible solution to the problem of glaucoma is increased intraocular pressure. Friends, we have covered many topics about our eyes, but there are still some disorders left that are related to neurological and autoimmune problems. We definitely need to talk about those as well. But that will be in the next video. That's all for today. I say goodbye to you. I remain always yours, Dr. Vladimir Miroslavovich Golod. Goodbye.